Again, thank you to everybody that's joined us today for this third and final day of the 2020 AgrAbility Virtual National Training Workshop. My name is Paul Jones. I'm the manager of the National AgrAbility Project, which is headquartered here at Purdue University. Our topic, the first seminar for today, is on case studies, case examples of the benefits between AT Act projects and AgrAbility. Our presenters are Kim Karwal from Easterseals, Iowa, and the Assistive Technology program there, and also Laura Plummer from the Wisconsin Department of Health Services. Some of you may not be familiar with AgrAbility. We are sponsored by the U.S. Department of Agriculture, and we focus on assisting people in agriculture with some type of disability or functional limitation. Every one of the AgrAbility projects is a partnership between a land-grant university and at least one nonprofit disability services organization. There are currently 20 projects funded by USDA around the country. There is also one national AgrAbility project. Again, that's led here at Purdue University through the Breaking New Ground Resource Center. And our partners on that project include Goodwill of the Finger Lakes, APRIL, which is the Association of Programs for Rural Independent Living, Colorado State University, and Washington State University. More information about AgrAbility is available at agrability.org, and there are also more than 80 of these archived webinars available if you're interested in other topics, along with many other resources that might be useful to you. Okay, at this point, I'm going to turn things over to our presenters, and I believe Kim is going to be presenting first, so I will make her the presenter. I will cut my camera, mute my microphone, and rejoin you after the presentation.
Actually, Paul, Laura will be presenting first.
Okay. I have Laura as the presenter right now. There we go.
Good afternoon, everyone. Thank you for joining the webinar, and thank you for the information and instructions, Paul. And both Kim and I are excited to be here today to share some information about the collaborations that can happen between the Assistive Technology Act programs and AgrAbility. So again, my name is Laura Plummer, and I am the AT Program Director for the state of Wisconsin, which means I oversee the Federal Assistive Technology Act program, as well as several other technology programs for our state. And Kim, I don't know if you want to unmute and give a short introduction for yourself.
Thank you, Laura. My name is Kim Karwal. I work with Easterseals, Iowa, with the Assistive Technology Program, and we are the implementing entity for the Assistive Technology Act in the state of Iowa and the Rural Solutions Program. So my title is the Assistive Technology and Rural Rehabilitation Support Professional.
Great, thanks. All right, so our learning objectives today include that we anticipate that you will be able to list the state-level activities or services that are provided by the AT Act programs, both in Iowa and Wisconsin. You will be able to identify 3 benefits of collaboration that can occur between an AT Act program and AgrAbility. And then participants will leave with 3 concrete examples, case studies, that demonstrate collaboration between that AT Act and AgrAbility. So we're going to begin with a definition. We always ask, what is assistive technology? And often when I ask that question, I get a wide range of responses, things from hearing aids to wheelchairs to reachers and bath benches. But essentially, assistive technology is any product or piece of equipment used to maintain or improve the functional capabilities of individuals with disabilities. A very common example that all of us have in our home would be our television remote control. At one time, that would have been considered an environmental control unit, which means we used to have to get up, walk across the room to change a channel. But that remote control, which was specialized, became universal for every television in every home. And this is the federal definition, by the way. So along with the definition of the devices is a definition of services. And AT services encompass a broad range of things, everything from evaluation, funding, design, customizing, modifying, maintaining, repairing, training, and technical assistance. And I read all of those off simply to demonstrate how many components are involved in the provision of not only the assistive technology device, but also the services that wrap around that. And keeping in mind that assistive technology is available for anyone, and we can all benefit from it, all ages, in disciplines at school, at work, as well as in the community and at home. Some general categories of assistive technology include devices for everyday living, so things for preparing your meals, for bathing, dressing, just getting around your home, to hearing loss and vision loss technology, vehicle modifications, wheeled mobility and DME, durable medical equipment, augmentative communication, software and hardware related to accessing a computer or a mobile device, as well as technology used within the schools. Many people, you'll find many vendors and providers of assistive technology around the country, and there is one certification, so while not required for most of the activities of providing assistive technology, is the Assistive Technology Professional, or ATP. And this is a certification that essentially ensures that you are working with someone who has a broad-based knowledge of assistive technology, of disabilities, of how to conduct a technology assessment, and is able to provide information and training regarding assistive technology. The website for that certification is referenced on the website or on the slideshow, which is resna.org. And keeping in mind that this ATP certification is only required for things like durable medical equipment. So for all the other categories of equipment, outside of some state licensure things for hearing aids or low vision technology, overall, many individuals, providers, and service organizations you may find are dealing with assistive technology. Some actual job titles that you might see regarding AT are an AT specialist, rehab engineer, maybe a rehabilitation technologist, someone who does adaptive equipment, or a practitioner. And in many states, the AT Act programs also collaborate with their federally funded independent living center. So it may just be an independent living coordinator or staff member that is dealing with and working with assistive technology for consumers. So I'm going to shift into speaking about the Assistive Technology Act directly. So this is a piece of legislation, so it is federally funded, and it was enacted in 1991 and has been updated and modified several times since that initial legislation. So the federal funding comes through the U.S. Department of Health and Human Services within the Department or the Administration of Community Living. So every state and territory for the United States has an Assistive Technology Act program. And part of that AT Act program is, well, on here we've got links to the Administration for Community Living so that you can familiarize yourself with the AT Act itself, as well as ACL handles the Independent Living Center grants. We also have information on the AT Act through ATAP and AT3 websites. So after this webinar, I do encourage you to kind of explore around, learn a little bit more about the law and the resources that are available. So the specific requirements of the AT Act begin with an AT Advisory Council, and then it's subdivided into state leadership activities and state level activities. And each state completes a state plan every 3 years that outlines all of the activities and the program budget, sort of the direction that that program will take for the state so that consumers have access to technology. So I'm going to begin with, so the AT, I'll back up a little bit. The AT Council is appointed and elected throughout each state, and that's who guides that state plan. So what I really want to focus on today are the nuts and bolts of the program, which are those state level activities. So the first of which is a device loan and demonstration program. So each of the programs has an inventory of assistive technology that is available for short-term loan and demonstration. And each of these programs has a broad range of technology. The federal government doesn't require a specific number of devices or specific categories. So programs work to ensure that they cover pretty much as many categories of technology as they can, and then make that technology available to try out. And we say short-term loans and demonstrations because the purpose is to determine whether or not that piece of equipment is the right solution and whether it will work for the person. I compare it to trying on clothes when we go shopping. So we can look at 5 different shirts, but to know what shirt is right for us, we need to try that shirt on. And so working with the AT Act gives consumers that opportunity hands-on to see if the device is correct, the best match or not. These loans and demonstrations can also be done as an accommodation while awaiting funding. So maybe someone has applied for insurance coverage for a device or some other type of funding that they can borrow that device while they're waiting to get the piece of equipment. The next state level activity is device reuse or reutilization, and this will vary state by state in how the programs are operated. But essentially, it is the mechanism in which used equipment, sometimes it's durable medical equipment, other times it's communication devices for people with speech disabilities, or it could be any type of assistive technology. And so that used equipment is refurbished, repaired, so that it can be turned around and either sold at a lower cost or donated to an individual that doesn't have access to that technology in any other way. So it allows people to repurpose the equipment they're no longer needing, and it also allows, keeps it out of landfills. And so each state has their own mechanisms in which they do that. And so if you learn more about your specific state's AT program, you can see how that reuse may be available to the consumers that you're working with. States also operate alternative financing programs. So these are financial loans geared toward assistive technology, vehicle modifications, or home modifications. And it is a loan versus a grant. Generally, it's a little bit lower interest. And these are designed to allow people that may or may not have the best credit, maybe due to being on Social Security, or they may be have poor credit history due to medical bills or things like that. Again, these programs vary by state, but it's a funding alternative, an option for someone to purchase assistive technology for themselves that may not be covered by other sources. The next piece of AT Act programs is providing training and technical assistance. So it is working with individuals and with groups or boards and other stakeholders to provide some specific in-depth knowledge regarding assistive technology. So for example, in our state, in Wisconsin, we provide technical assistance to our telecommunications equipment programs, so assisting them in meeting the needs of consumers. We also work on policies that are designed to address the coverage of assistive technology under Medicaid services. We also reach out and share information about funding resources and try to close those gaps in knowledge from one segment of service providers. So maybe an aging unit may not be familiar with employment opportunities for people with disabilities. So it's really to build that knowledge base regarding technology around each state. So additional information on the AT Act programs can be found at the AT3 Center, which is www.at3, the numeral 3, center.net, or atap.org, which is ataporg.org. And so they have links to each individual state program, links to the federal legislation regarding the AT Act, links to additional resources, webinars that are archived, and then training events that are happening. Most states have ongoing assistive technology training for providers. Generally, those might be a conference, they may be free, or they may be fee-based, but a comprehensive resource listing of those can be found on these websites. Some other resources to be aware of, that, and we have these references later on in the slides, are your telecommunications equipment distribution programs. So you may be working with a consumer and you're piecing together various funding programs, but each state does have funding to assist with the acquisition of specialized telecommunications. So it might be amplified phones and light flashers to alert people to the phones. It might be alarm clocks to alert someone that's hard of hearing, and that can tie in with the phone. It may be a caption phone. It may be a remote control voice-controlled phone for someone that is in a wheelchair and has a mobility disability. And then an additional resource is the I Can Connect national program, and this provides distance communication for someone that has a combined hearing and vision loss. So you may think that's a classic, someone who is classified as deafblind, but it is really a broad range of hearing loss and vision loss, as long as it's a combination. An example of some funding of an experience with that in the farming community is I had a farmer that in his barn, he was no longer able to hear that phone ring. And so we were able to use the telecommunications program for him to purchase amplified phones and light flashers that we then placed in a barn so that he was able to be aware of when the phone was ringing when he was out in that area. Another resource to be familiar with are your federally funded independent living centers. So these are consumer-driven organizations, nonprofits, and they receive federal legislation and funding, and it is a nationwide network. Each state will vary in how many they have. Kim will be able to share maybe how many are in Iowa. In Wisconsin, we have 8. In California, I know there are 28. So it does vary per state, but they are required to provide advocacy, some skills training. They serve for information and referral. So if you're not sure where to go, they can answer those questions. Peer support and transition. And then some provide different services. In Wisconsin, they actually provide our Assistive Technology Act, the loan and demo programs for us. And then our state program areas that should always be considered to collaborate with include your state vocational rehabilitation programs. And that's not just the state programs, but also most tribal entities also have vocational rehab programs, as well as social services programs. So I've had many consumers where we've partnered with the state Voc Rehab, the tribal VR, AgrAbility in some cases if it is agriculture-based employment goals. And so really building those teams and the collaboration can bring all of the different resources that are needed for success for the consumer. And then each state does provide offices for deaf, hard of hearing, for blind and low vision, and remembering your aged offices and your education departments. I do like to share information about if you have more interest in learning about assistive technology overall, the Assistive Technology Industry Association has an annual conference in Orlando that it is probably the most comprehensive vendor hall and session listing related to access for individuals with disabilities. And then you can get all of that knowledge also via webinars and their professional development. And then I believe our last resource I like to share is something that is probably an untapped resource in some areas, and it's maker spaces. So another potential collaboration for AgrAbility programs and providers is to work with your local or regional makerspace. So this is a blending of the do-it-yourself movement with kind of artisan. It ties very closely to the farming community, at least in our state in Wisconsin, because agriculture industry has always kind of made do. You know, they fix things up to work for themselves, like a very unique one-off solution. And so makerspaces is just an expansion of that. So there's actually facilities that are maybe volunteer run. They might be university based, but it blends a unique skill set of varying people to have a unique solution for somebody. That it might be a product that's not commercially available, and so it'll be customized and built specifically. And then I do like to, before I turn it over to Kim, I just was going to share quickly on one of the other examples where our state AT Act has partnered with our AgrAbility program was a farmer with a vision loss. And so the AgrAbility staff member and an AT specialist went out, did that assessment on the farm to specifically look what vision loss technology is going to be needed so that this gentleman could continue his work. And so through that assessment process and collaboration between the programs, we were able to identify a talking barcode scanner for the ear tags for the cattle. We also worked and did computer access so that he could still do his book work, his ordering of product, things like that. And then we also went through the barn area and worked on doing some tactile and high contrast marking so that he was less reliant on vision, where he could use his hands to feel around and reduce that visual fatigue that then allowed him to continue doing the farm work that he wanted to do. So it was a great way for the AgrAbility staff member to learn about vision loss access, and the AT provider had the ability to learn more about different farming mechanisms and components and things to look at when doing assessments related to agriculture. And I'm going to go ahead and let Paul turn it over to Kim. So thank you very much.
Thank you so much, Laura. And Paul, I assume that I have access to the slides. Thank you, Paul, for getting us started today. Again, my name is Kim Karwal, and I work with Easterseals, Iowa, and I'm going to be talking about how at Easterseals, Iowa, we combine both our state assistive technology program with our Rural Solutions program. Our Rural Solutions program is very similar to AgrAbility. Our previous existence was as an AgrAbility project many years ago, but has since changed. Overall, Easterseals, Iowa has over 16 program lines providing services to individuals with disabilities statewide. Our mission is to provide exceptional services to ensure that all people with disabilities or special needs and their families have equal opportunity to live, learn, work, and play in their communities. I chose the photo that is on this slide because it's a demonstration of an individual living independently in their home with the support of assistive technology. This young man is using in this photo an adaptive cutting board and adaptive knife to cut bell pepper. I especially like this photo because it also encourages healthy lifestyle with the healthy choice in food. A brief overview of our assistive technology program. As I've said before, we are the state implementing entity, and we partner with various other entities in the state, including our state independent living councils, which Iowa has 6 centers for independent living, as Laura had asked. We serve all ages across the state of Iowa and in all 99 counties. We don't technically require a diagnosis in order for someone to request services through our assistive technology program, although we do ask that they be able to discuss what they're experiencing that led them to desiring assistive technology as a potential solution. We provide information and referral services. Oftentimes, we give the example that you don't know what you don't know, and if you're thinking that there's a barrier and you want to just explore what resources exist, we are the entity to contact. If we're able to help internally, that's fabulous. If not, we'll provide that information and referral for external services. On site at Camp Sunnyside in Des Moines, Iowa, we have our demonstration center where we can demonstrate over 1,000 devices to support recreation, health, leisure, independent living, computer and accessing technology, including augmentative and alternative communication devices, as well as education and learning experiences. I'll go over to the photo real quick. In this example are 2 young men who are playing with a soccer ball. You cannot tell from this photo, but that soccer ball actually has bells inside of it. So when it is rolled, it has an auditory stimulus to help identify location of the ball, and also as just an interactive means to encourage play. So it can encourage grabbing, sharing, pushing, throwing, kicking, whatever the task at hand, but having a little bit of additional sensory support for that. We have a lending library. So after demonstrating an example like this soccer ball, we could then loan it to this individual for a 30-day trial period loan for the purpose, as Laura mentioned earlier, for the family, individual support provision, whoever accesses that loan, to make a decision as to if this is a piece of technology that would be suitable for a particular task or not. If it's decided that it's appropriate and they desire to access the vendor information, we can provide that. We then have our durable medical equipment loan program. This service operates solely on donated durable medical equipment from across the state. We receive this equipment, which would include wheelchairs, Hoyer lifts, lift chairs, and a variety of other items. In-house, we'll sanitize and refurbish to ensure it's in working condition so that we can loan back out to Iowans who are in need. We will often see that insurance provided coverage for one specific device that was deemed appropriate for that individual's use in a particular environment. But once they engage in another environment, including a gravel road outside their home or ice in the wintertime, they identify that that piece of technology is no longer suitable for them. So insurance and their healthcare providers may have identified a walker as an appropriate mobility device, but once they're trying to get out and get groceries on a day like today when there's residual ice patches, including black ice from a recent thaw and refreeze, that walker might prove an additional hazard, whereas possibly obtaining a manual wheelchair through our durable medical equipment loan program would be a sufficient device to utilize in that environment at that time. We also host the Assistive Technology Exchange, which is hosted on an online platform called AT4All, which many other states also utilize a similar platform. The AT Exchange is much like a Craigslist, where any individual can post an item that they have that they would desire to sell, or post a want ad for a device that they are seeking to find. Easterseals does not exchange the devices or the money on the exchange platform. We manage it to ensure that Iowans have the ability to post devices that they want, even if they're not internet users. So if an individual calls us and wants to post it, we can do it on their behalf over the phone, or oftentimes individuals will mail us pictures that we can scan and get posted along with that device. The AT4All website that we also host in conjunction with the AT Exchange, we post our entire inventory of our lending library. As I said before, in Iowa, we have kind of a combination where our Rural Solutions program is also in existence through Easterseals, Iowa, and shares many of the same staff members as our Assistive Technology program. Our Rural Solutions program is purposed to support Iowans that live with a disability in a community of 2,500 or less in population. It began truly as a service to support farmers. As I said, its history is deep-rooted in the AgrAbility project and the family members of those farmers that experience a disability or a limitation. We find that oftentimes farmers are resistant to use the term disability, as I'm sure many AgrAbility projects find. So being able to network with them and communicate with whatever language that they deem appropriate and that they identify themselves, and still help them to identify potential solutions is very resourceful. A variety of our services include, but are not limited to, on-site agricultural worksite accommodations and home modification consultations to ensure for accessibility and access, peer support, services for the family and support network, information and referral, that access to the Easterseals, Iowa Assistive Technology Program. And so just the example would be a lift for an individual to gain accessibility into their workplace. And I'll talk a little bit more about that specific example later on when I talk about the individuals. So this first example is not that one that I was just referencing. This is a video that is available on YouTube if you search for Rural Solutions in the state of Iowa, or we can also provide the links for these. in this video, it features Mike and Trish, so veteran Mike, who, when returning from his service from Iraq, returned experiencing symptoms of post-traumatic stress. After his return, he was also involved in a motorcycle accident, leaving him with some residual injuries. When he first became associated with the Rural Solutions program, he recognized that there was benefit in having individuals that are knowledgeable on both the agricultural related aspects and the benefits that farming has for an individual's mental health. My team member Chuck worked closely with this specific situation and identified various supports for Mike throughout the process. Utilizing an agricultural work style, meaning that that individual, Mike, who is the farmer, can control what time he needs to get up in the morning, can control if he needs to access additional supports for that day, and he can make those decisions on his own or in collaboration with his wife and family members. He can then utilize the 10-acre farmland, which he manages, in order to ensure that he has purpose to fulfill on a daily basis, as well as employment to support the family. He will say that the biggest help to him was that he identified that he can do things differently. And I love that quote because it doesn't need to include a piece or a technology or a tool. It can just be performance of a task in a different manner. So access to the Assistive Technology Center, as well as the Rural Solutions program hand in hand, was a great benefit because there could be various tools demonstrated and just the discussion on the difference that tasks can be performed. So this is one of my favorite stories. It features another Mike who was in a motorcycle accident as well, but he experiences paralysis, which has resulted in him using a manual wheelchair. He manages his farm operation and scouts the fields that he manages, and has needed to do so in a variety of ways since his injury. Chuck Larson, who is in the back of that picture there, worked very closely with Iowa Vocational Rehabilitation Services, and one of those individuals is also photoed there, to help identify what various technologies exist. I chose this story because it was a great benefit to partner with Iowa Vocational Rehabilitation Services, and we were so graciously connected with their AT personnel, and we were able to collaborate to identify a variety of solutions, identify a variety of tools, demonstrate, loan, figure out what's working and what's not working, to then move towards some larger level solutions for this that include various office technologies, lifts, and an action track chair. And I will now give it back to Paul, who will be able to show this last video, as I'm sure you want to hear from some other entities rather than just me. Thank you very much, Paul. I do like to follow that video up with just mentioning that Easterseals, Iowa does not provide the funding for any of the accommodations or modifications that are put into place for the Rural Solutions program clients. We do partner with funding entities and/or the individual accesses funding sources available to them for many of those modifications. And on one of the previous slides, there was a very green tractor, and I did want to mention that we don't partner specifically with any individual vendors. We appreciate the opportunity to be able to demonstrate a wide range of devices, solutions, and modifications, and then allow that individual the opportunity to explore various vendors so that they can make an informed decision on where they decide to purchase their equipment through. Laura, if you want to hop back on and talk about your contact and follow up, I can mute myself and let you take this slide.
Sure. So, and Kim will say the same thing, but we are both, I'm sure, very happy to field questions. Feel free to reach out for us if you want clarification or information. There was a chat message about AT for All that I typed in response, but I'm happy to answer that. So AT for All is a platform in which we use just to kind host an online presence for the loan and demonstration programs and some of the reuse equipment. So there's about 17, I think it's about 17 states out of all of the ATX participate in that. Others have developed their own systems. It will vary depending on how they've individually set it up by each state. And generally, the programs do work with the residents of their respective state. But if you see an item or something, or have a specific question and you're just not sure who to contact, you can either reach out to either of us or reach out to your state program. We did have a link for that earlier, and we're happy to try to answer and direct you to where you need to go.
And I echo Laura. I'm so grateful to have had the opportunity to present to you today, and feel free to reach out. I will hand it back to you, Paul, if you would like to start addressing any of those questions or that survey.
Okay. Thanks very much, Kim and Laura. Excellent information and some great stories there. Great examples of collaboration. Either of our presenters is welcome to chime in on any of these questions if you'd like.
Yeah, this is Laura. I can chime in on that one quick. That's all right, Kim. So what is involved in becoming an ATP? So the website, which is resna, resna.org, essentially is a certification exam that you take. And then you do have to meet certain qualifications as far as your educational background and or years of experience working with people with disabilities and using assistive technology. And then once you acquire the ATP, then you are required to do a certain number of hours of continuing education units every 2 years. You have to have basically 2 CEUs. So, but the website does outline what is involved in becoming that ATP. But be ready to take a big test.
I was just going to add in with that ATP aspect of it as well. There are a number of different lines. So if you have specific levels of education, there's a number of training hours that you need to have. But as Laura said, RESNA does outline everything and helps you work through it. They're also incredibly responsive over at RESNA. So if you do want to interact with someone directly and really talk about how you would qualify for sitting for the ATP exam, they're very, very helpful.
You want me to answer that one, Kim?
Sure.
So the AT Act projects themselves do not, in just the AT Act funding dollars, they do not actually provide or purchase equipment for consumers. Some programs or agencies may have additional resources or opportunities, but in and of itself, it does not pay for equipment for individuals. So as far as specific to hearing aids, again, they may be able to point you to other resources or other programs, even looking at whether it's an employment-based need or an education-based need. And so unfortunately, but one of the things we do is that technical assistance is that policy work. And so at a statewide level and a national level, the AT Act programs do work towards things such as this with the coverage for hearing aids.
Do you ever customize AT for farmers instead of relying on vendors? That is a fabulous question. We have to be very careful with any customizations that are done to ensure that they do not accrue any liability on the part. Easterseals staff ourselves do not do any of the customizations. We can assess that piece of equipment that commercially available piece or part, and then provide advocacy and support the consumer in identifying possible resources that could support them in modifying it. So the example I give is a lift for a tractor. All tractors are different. If they decide not to go with something commercially available, such as an essential life lift, and they want to mount a lift to the side of the tractor itself, that comes with a lot of liability concerns. That lift itself needs to be very individualized to that person. Is it a lift for the wheelchair? Is it a lift for them to stand on? How are they mounting it? How is it lowered? How is it attached to the tractor? We can go on and on. So we support that consumer, that client, in identifying local machinists or local vendors or local entities to support them in any modification or construction. We say local because it is most impactful, although we aren't a huge state and you can get just about anywhere in under 4 hours from Des Moines. You don't really want to have to send your combine somewhere 4 hours away in the middle of October because something breaks on your lift. You want to be able to have it be somebody local, somebody nearby that can provide that support.
Okay, I'm just going to double check our chat area to see if there's more questions there. It looks like that covers it for now. So thanks again, Kim and Laura. Some excellent information, some great examples. We definitely appreciate your time in preparing and presenting the webinar today. So thanks very much.
Thank you.
Yes, and again, feel free to join us, anyone out there who would be interested in learning about outreach to underserved populations. And we'll be reconvening again at 3 p.m. Eastern today. So we wish you a good rest of the day.